Clearly, I think the answer to this question relies upon having a good relationship with with the doctor who's treating you. I think one thing that is very important from a patient perspective is to ask about clinical trials, because not everyone will freely engage in that. Depending on where your doctor is practicing, they may not have clinical trials available. But if they know that you're interested in it, they'll usually try to help you find a trial or find a place where you might be able to enroll into a clinical trial. So I think it really starts with the relationship with your oncologist, and that, I think it's very important that patients sort of empower themselves in terms of, really don't be afraid to ask if there's something else out there, if the treatment that the recommendation that you're getting is not something that you're comfortable with, because there very well could be clinical trials that may be an alternative to what you're doing. When asking these questions, we have to decide whether we think that a clinical trial is a better option than doing the standard treatment. And I think it's always really good to have a very honest and frank discussion with my patients about what I expect to happen with the clinical trial. Why would we do this now versus some other treatment? And when is the right time to enroll into a clinical trial? And I think a lot of it will be dependent on how your relationship is with your oncologist. And if you're not getting the information that you think you need, it never hurts to get a second opinion from another oncologist to see if they agree. I think all of us across in the field, in some degree, are looking at the patient's best interest, and we really want to help patients. And if there's a patient that I see that is looking for a clinical trial and I don't have one, it's very easy to try to help them find a place where they might be able to enroll. And as I've said before, it's critically important that we enroll patients into clinical trials so we learn what's better. And so we're always willing to support patients if they're looking for a clinical trial, but also able to tell a patient, no, maybe that's not the right thing right now. We can do this later.